So there is a substantial risk for developing an alcohol problem after patients have had a gastric bypass. And about 5% of gastric bypass patients end up with a significant alcohol problem afterwards. Some of those patients had an alcohol problem beforehand, right? But most did not. Most did not. So what's going on? So whenever you, normally when you eat food, right? We normally eat food or drink alcohol. The food goes down through the esophagus into the stomach. And in the stomach, it sits there for a little while. As the stomach, there's some digestive enzymes that are added to the stomach. There's actually some alcohol metabolizing enzymes as well. And there's a little muscle that is right at the end of the stomach where it connects to the small bowel called the pylorus. And the pylorus opens up, sends a little food into the small bowel, then closes down. And it does that periodically, sort of to meter the amount of food going into the small bowel, right? So that metering allows for the food to be absorbed more consistently over time, prevents this big dumping sensation, right? And for alcohol, it also sort of sets the dose that's going in per unit of time. So now, if you've had it, there are a couple kinds of gastric bypasses. One is patients might have something where they actually take the small intestine and sew it to the side of the stomach, so that it literally bypasses the pylorus, right, and bypasses some of the absorptive surface of the small intestine, and that's how patients lose weight. That's called a Roux-en-Y. There's another procedure called a gastric sleeve. They put something around the stomach to make the stomach much smaller, so the stomach can hold less food. The pylorus is still intact in that, but because the stomach's smaller, there's much more rapid gastric emptying into the small bowel. If you take alcohol in either of those circumstances, the alcohol gets to the small bowel where it's absorbed much quicker, right? And the blood levels really rise up quickly, so that people have a much more rapid increase in their blood alcohol concentrations. And this has been documented in really some very clever science, where people took patients before gastric bypass surgery and after, and they had them drink a couple of standard drinks before and the same couple of standard drinks after, and their blood alcohol concentrations were up to 3 times higher post-surgery. Okay, so this is making your standard drink 3 standard drinks, right? And if that doesn't make you sick, and for some people it doesn't, right? That's puts you at much higher risk of developing tolerance and dependence to alcohol. Okay, so that pharmacokinetic change, that change in how the body handles the alcohol, right, is the likely basis for the higher rate of alcohol disease, alcohol use disorder in people who've had bariatric surgery. So it's important, if you've had bariatric surgery, right? I think the surgeons will warn patients that they have an increased risk of alcoholism afterwards and suggest they not drink. That recommendation is usually for the first year only, but this can happen anytime after surgery. And actually, most people develop their problem about 2 years after their surgical procedure. Okay, because it does actually take a little bit of time for these higher blood alcohol concentrations, right? This greater exposure to alcohol to translate into tolerance and dependence that becomes sort of self-sustaining and harmful. So I think if you have bariatric surgery, you should get a breathalyzer right away, right? And you should be following your BACs. And if they're above 0.08, like after a drink, you need to watch out, and you might want to consider getting on some form of active treatment at that point to prevent progression. Okay. So you can in this particular state, you can actually learn a lot by just following your BACs and actually doing that. Okay. And that'd be my recommendation. But we've had many patients in Ria who've had bariatric surgery, and I ask them, would you go back and still have the surgery? And they all say, yes, I would absolutely still have the surgery. So I wouldn't, like if you're 300 pounds and you have sleep apnea, and you're getting diabetes, and your knees hurt and you can't walk well, and you're beginning to develop heart failure, surgery is life-saving. Okay. No question about that. But you do have to be attentive to this post-operative risk, and manage it aggressively. There aren't many people who are paying attention to this, like in the addiction community, but they're at Ria, we definitely pay attention to this, and it's an area of real interest.
For expert support on medication-assisted treatment for alcohol use disorder, visit riahealth.com.